welcome to Hudson Health. My name is Dr. Angel Lazo, and I'm with RWJ Barnabas Health. And I'm going to introduce you our co-host, Dr. Akunyili.
Hello, everyone. My name is Dr. Ije Akunyili. I'm Chief Medical Officer at Jersey City Medical Center, a part of RWJ Barnabas Health.
Now, we're going to be having a series on different health topics in your county, in Hudson County. And again, Robert Wood Johnson Barnabas Health is one of the leading institutions actually in our community. And we're going to be talking about some of the new things that we're offering actually in Hudson County. And specifically, we have a new location actually in Hoboken. And we have a special guest that's actually going to talk to us and references some of the services that are actually provided at that facility.
One of the fascinating things about Hoboken is the comprehensive care we get. There is the physical therapy where you get all kinds of treatments for skin, soft tissue injuries with exercise physiologists, physical therapists. Then at the other continuum, you can also get lab work through a LabCorp. And then there is a network of imaging through New Jersey Imaging Network, so you can get mammograms, ultrasounds, CAT scans, etc.
Okay. We're now currently going to go to break, and then we'll be right back.
Jersey City Medical Center is healing, enhancing, and investing in Hudson County because your heart doesn't beat just for you. So get it checked. When your bones are healthy, it lifts us all. We're delivering joy daily in our Lord Abbott Maternity Wing and providing New Jersey's only NCI-designated comprehensive cancer center. We'll continue building our medical network and taking every precaution for your safety so that we can all be healthy together.
Panepinto Properties, Jersey City, shaping the workplace with state-of-the-art office spaces and addresses your company desires. Building residences that define your home environment, adjacent to all modes of transportation with on-site parking available. The right address, the right lease. Call 201-521-9000 or visit online at panepintodevelopment.com. Panepinto Properties, building Jersey City for everyone.
So welcome back to Hudson Health, and we're going to be talking now a little bit about some of the services that we actually offer in Hudson County as part of RWJ Barnabas Health. We have several new locations. One of our big hubs right now is actually in Hoboken, and we're going to focus a little bit on Hoboken and what we offer there. I do internal medicine and board certified internal medicine, and I do academia. And again, this is very passionate for me, especially in the community. Again, as an internal medicine doctor, prevalence of disease is actually very important to us. And again, we provide in our new location in Hoboken a vast array of services, of which we will expand on.
Absolutely, and I am a Chief Medical Officer. I'm also a board-certified emergency physician, but usually would want to make sure that you have other access to health care prior to coming to the emergency room. One of the fascinating things about RWJ Barnabas Health is really the investment it's made in Hudson County. In expanding its footprint, it's really done everything to increase access to health care in everything from primary care, as we're talking about, to specialty care, to really getting enough people access to whether you live in Hoboken or Exchange Place or Bayonne or Colony Plaza. All these locations are built with the intent of serving our community and making sure you don't have to travel, because what is it the saying goes, healthcare doesn't travel well. That's correct.
But again, we offer the services that are really needed and actually in this community.
Absolutely.
A lot of the primary care services are extremely important, especially when you consider the prevalence of disease. For example, in the new location in Hoboken, we basically cover all the services to include cardiology, urology, hematology, obstetrics and gynecology, orthopedics. But from the internal medicine side, having that cardiologist, having the gastroenterologist, having your hematologist, your rheumatologist in the same location with your specialists, your primary care doctors, is actually key. Now, one of the things that I really like specifically about RWJ Barnabas Health, and that's part of the reason I'm with them, is their academic affiliation. In fact, they just announced that Mr. Leibowitz is actually now going to be vice president of their academic practices. And that's a big deal because that really puts RWJ Barnabas Health front and center in the state of New Jersey as having the most academic practices with the merger.
I could not agree more. Our academic affiliation brings us a new whole level of healthcare and expertise, quite frankly, to our communities. And something we mentioned, we have friends and families that talk about access to healthcare and how important it is to have every specialist, every test in one place. So if you're a middle-aged woman and you want to get your mammogram, you also want to have the radiologist on site and to have primary care, etc. So it's the convenience of healthcare, but not just any healthcare, top-notch academic enterprise with a wide array of specialties and primary care doctors. I think that's unique, what we bring to this community.
Very unique, and especially in this community that is so underserved and such a need. Later today, we're going to be talking actually with Dr. Trespalacios. Dr. Trespalacios is also an internal medicine doctor, specialized, board certified. She's one of the regional managers, actually, for medical doctors for RWJ Barnabas Health. And she's going to be talking about some of the specialty things that we do actually in Hoboken and how she coordinated all that and set all that up. So it's very exciting news here for Hudson County. Very exciting.
I'm personally excited to bring in Dr. Trespalacios. She's phenomenal. And something you mentioned, which is part of our DNA, really, at RWJ Barnabas Health, is equity. Equity is part of health equity, is access to care, and we are committed to this community and ever more so increasing our footprint and our planning to make sure members of our community are able to come to us whenever they need help.
But I really think it's that family at RWJ Barnabas Health that really makes a difference. I mean, we communicate very well. We all share a common EMR that basically has all the information. It's the most modern, actually, EMR actually out there. And again, this is really to serve our community and to help establish ourselves as the leading institutions, actually, in Hudson County and beyond.
So our electronic medical records means that not only do all the doctors taking care of you have access to your care, but the therapists, the specialists, but you also have access to your care. And I think that's a game changer for this community.
It is, because especially being part of an academic practice, that autonomy that we love that patients have, we're there basically to guide them and to give them the information so that they can make educated decisions as far as their health care. This is part of the reason we're doing a lot of these series, is in order for the public to basically understand what we're doing. And again, we'd like to hear from you as well. What are the things that interest you from a medical perspective? Because we are the leading institution in your county. So how can we better serve you? And these are some of the questions we're hopefully going to be answering. All right, we'll go ahead and go to break. Thank you very much.
Jersey City Medical Center has a passion for heart health. We're Hudson County's only full-service heart hospital, with innovative technologies and premier cardiovascular physicians, a partnership with Rutgers Health, the latest technology and medical advancements, and nationally renowned care for every heart in every community. Whoever your heart beats for, our hearts beat for you. Jersey City Medical Center.
Newport, the luxury waterfront community on the Hudson River, offers a quality of life you deserve in one of our many high-rise towers. With amenities such as the on-site Newport Path, light rail, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Kohl's, JCPenney, Macy's, and Target. Morton Williams and Acme Supermarket are just outside your front door. A health and fitness center, skating rink, and medical facilities are also on site. Enjoy the New York skyline from our waterfront and various parks. Manhattan is just one path stop away, or quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Looking to visit? Stay at the Westin or Marriott Hotel. For more information, visit us at newportnj.com. Make lasting memories to cherish forever. It's incredible. It's you, Newport. Live like you want.
Welcome back, everyone. Again, I'm Dr. Ije Akunyili. I'm Chief Medical Officer at JCMC, a part of RWJ Barnabas Health. In the last segment, we talked about the amazing physicians we have as part of this network, and it is my enormous pleasure to welcome one of them, Dr. Vanessa Trespalacios, who is the Regional Medical Director for Primary Care in the Northern Region. I'll pass it over to her. Tell us more about yourself. Welcome. Good to see you.
Thank you. Thank you very much. So, yes, I am the Medical Director of the Northern Region for Primary Care for RWJ Barnabas. However, I also still practice clinical medicine, meaning I am still seeing patients in the office as a primary care doctor. Therefore, as medical director, I'm able to really work with our doctors and our patients to fulfill their needs and try to improve access and improve quality for our entire healthcare system.
Perfect. Welcome.
Well, welcome, and we're very glad you're actually here, especially I, as an internal medicine, can totally relate to everything that you do. And thank you very much. But tell us about some of the highlights at RWJ Barnabas Health at Hoboken. You know, tell us the things that are important for the patients to know.
Absolutely. So the main thing, the first thing is that it is a multi-specialty space, meaning it's not only primary care doctors that you'll be able to see in the actual space, but we also have a number of other specialties. So ultimately, you would likely be able to have all of your care from different specialists in the same location. We've also partnered with LabCorp for lab services. So at your appointment, you can come in and have your blood work done right there and then. We've partnered with JAG Physical Therapy, so those patients that need physical therapy services can go right next door in the same space, in the same location, and see their physical therapist there. And finally, we've also partnered with NJIN, New Jersey Imaging Network, and there will also be all of the imaging services that one might need, such as x-rays, CAT scans, MRIs, and so on and so forth. And the final thing that I want to mention about why one of the biggest highlights of this new hub is its location. It's within walking distance of the Hoboken terminal, and so that creates easy access for all of our patients in the community. And that was a really important part of this, having it be in a location with easy access, so that even patients who are not driving or don't want to deal with the parking situation, the location is so close to the Hoboken terminal that you could walk there.
It's fantastic. So we know just how pivotal good primary care is to a foundation of healthcare, but we also want to know what kind of specialty services you have within this model and this framework and this place in Hoboken.
Absolutely. So currently, obviously, primary care, that's the biggest part of this new hub, but we also have cardiology currently, we have OBGYN, we have orthopedics, vascular surgery, and urology, and we're hoping to introduce other specialty services as well.
So if I'm a patient in Hudson County and I'm looking for a health system, I'm looking for a place, got a new location, as a patient, what kind of patients are we really seeing there?
We're seeing all kinds of patients there. Anyone who is looking for a primary care doctor or who needs a cardiologist or other specialty services, but all patients are welcome, and our goal is to meet each and every patient's individual needs.
We're going to be going to break now. We'll be right back.
I've got cancer.
We've got the highest level of cancer care,
the latest clinical trials,
researchers working to find a cure,
and nurse navigators to guide you every step of the way.
At New Jersey's only NCI-designated Comprehensive Cancer Center, your safety has always been our top priority.
I've got cancer, but I also have peace of mind.
Jersey City Medical Center and Rutgers Cancer Institute of New Jersey. Let's beat cancer together.
Consumer Carpets, 3408 Kennedy Boulevard in the Jersey City Heights, your one-stop store for residential and commercial floor treatments, carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants, all major brands, all in stock. Free estimates, same-day installation. Consumer Carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer Carpets, price to fit your budget, installation to fit your schedule. On the net at consumercarpets.com. Consumer Carpets, Jersey City, 201-792-2712.
Welcome everybody to Hudson Health. Once again, we have Dr. Trespalacios. She's our medical director for the northern region at RWJ Barnabas Health. So I wanted to talk a little bit more about our Hoboken location. Again, being mostly a primary care site, and especially with different disciplines there, including cardiology and so on and so forth, wanted to talk about what we did, especially from the primary perspective, because again, prevalence of disease really dictates that really everything originates from there, so to speak. But again, I'm an internal medicine doctor and I see adults from 18 and above. But I believe we do have family practitioners that see kids. We're able to see adults as well, and so on and so forth. So let's talk a little bit about some of the services that are offered there, especially, for example, with the prevalent disease, about the cardiology and so on and so forth, because it's very important. The integration of the health for our patients is extremely important. So the communication between our doctors, and not just in Hoboken, in other words, because we are in Jersey City and in Hudson County, so to speak. And Jersey City Medical Center is our biggest affiliate hub as far as a hospital. So talk to us a little bit about what we offer there, what kind of patients we can see.
Absolutely. So as you said, the new location has primary care, and currently we are seeing patients 18 and over at this location. The beauty of having a multi-specialty hub or multi-specialty location is the integration of care. For example, cardiovascular disease being the #1 cause of death in the United States, it's very important to have open communication between primary care doctor and the patient's cardiologist, and then add to that the open heart program at Jersey City Medical Center. And being that we are all one system, the communication is seamless. We all share the same electronic medical record, and so if you're a patient, you come see me, for example, at the Hoboken location, and I document what's going on, and then I refer you to the cardiologist at the same location. You see them. They can see everything that I've done, all of the tests that I've done, and what my notes say about what my thoughts are on what's going on with your health. And then when that patient potentially is referred to the medical center for surgery, that cardiovascular surgeon is also able to access all of the records. And so this provides better quality care for all patients. Communication between your providers, between all of your doctors, your specialists, and your primary care doctor is so important for quality of care. That is really one of the most important things, having the communication between, like you said, one big family, having the communication between all of your providers.
One of the things that I really like, because I'm in a new location, but now that the Hoboken opened, I'm no longer in the new location because I'm in an exchange place. In an exchange place, again, we got the same thing. We have kind of like a multi-specialty group. We also have, for example, LabCorp. We also have our rehab, which is great for me because I get to see the advancement that my patient have during rehab, and actually the rehab individuals actually come and actually talk to me. I mean, obviously on the electronic medical record, I see their notes, which is very important. But to have them just next door, you know, is incredible because I'm able to really focus on a lot, all the total care for my patient.
Absolutely, absolutely. As primary care doctors, we really see our patients as a whole, not as a subset of systems or just your bones or just your heart. So primary care doctors really see you as a whole.
So I would say, as someone who's dedicated to health in Hudson County, just to see this incredible team working together with the primary care doctor as a quarterback, if you will, for this seamless team is fascinating. But I wanted to ask you, and this is a question on the minds of so many of our patients who are busy parents, working professionals, etc. How, you describe this immense framework of primary care and specialist care. How easy is it to get an appointment? How does that work? Is this something they have to wait on the phone forever? These are just some of the things that people out in the community worry about in terms of accessing healthcare and may even discourage people. And we want you to speak a little bit about how this is, I think, a different game altogether.
Absolutely, yes. The new location has multiple physicians, multiple doctors, multiple providers, and so that provides more open access to care. Patients can make an appointment by calling, of course, but with online access, you can also make an appointment through your online chart once you've become an established patient, that is. We also are taking walk-ins, and we often offer walk-ins, and so if you are at the Hoboken station and you walk over to our new hub, you can just walk right in, and if there's an availability, which most often there will be, they can see you right there on the spot, ideally. Or at the very least, you can make an appointment right there and then.
That's fantastic. So as an emergency physician, I see people in really, really acute states, but I understand, and I think part of the foundation of healthcare is preventative care. So there might be young people or people out there that feel like, well, I don't have any medical problems. I don't really need this. What would you say about preventative care and how that's the foundation? What kind of preventative care services you offer?
Absolutely. I'm glad you brought that up because that is actually one of the things that I talk about every single day with so many patients. I hear often, well, now that I'm 40, I figured I'd come and see the doctor, and they haven't seen a doctor for many years. But really, it's about prevention. Once we have the disease, it's so much more difficult to backtrack and resolve that. So prevention is finding things early on so that you can prevent them from progressing or even cure them at that stage where it's really early on. that's preventative care. That's all, not just mammograms and colonoscopies and so on and so forth. It's also just coming in once a year, talking to your primary care doctor, getting some blood work to look at things like your cholesterol and catch those things early, or your blood sugar and catch those things early. Having your blood pressure checked by the doctor so that we can catch high blood pressure early and maybe counsel and talk and educate on how we can reduce that blood pressure or improve your health. So yeah, it's really important. We are the quarterbacks, as Dr. Lazo mentioned, and prevention is key.
But you're dealing with a really top-notch team, and this is part of what I really love about RWJ Barnabas Health, because they are academic practices, and what that means to our community is we're following the guidelines, we're following the latest technology, and then again, we're bringing this to the community and we're bringing this to our patients. Thank you very much for being on our show today, and we'll be right back.
Jersey City Medical Center is healing, enhancing, and investing in Hudson County because your heart doesn't beat just for you. So get it checked. When your bones are healthy, it lifts us all. We're delivering joy daily in our Lord Abbott Maternity Wing and providing New Jersey's only NCI-designated comprehensive cancer center. We'll continue building our medical network and taking every precaution for your safety so that we can all be healthy together.
Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design, studio, and large inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net.
Welcome back to Hudson Health. I'm Ije Akunyili. I'm Chief Medical Officer at RWJ Barnabas Health, Jersey City Medical Center.
And I'm Angel Lazo, internal medicine, and I'm currently in Jersey City at Exchange Place.
So I want to start by just saying how wonderful it was Dr. Trespalacios, right?
Absolutely.
The good old primary care doc we all wish we had. I was taking notes during that segment because, we're physicians, but we also want to have our own good physicians. And I thought, I need to make an appointment to go see that.
Absolutely. And again, I do internal medicine, so that is a huge passion for me. But we really, really, really integrate the care. That's the really important part that I think Dr. Trespalacios, the message she was getting. The integration of care, especially being an academic affiliated institution, is really where the money is for Hudson County. Health is something that you really cannot buy. And this is why it's important. It doesn't matter what your socioeconomic status is. Diabetes is diabetes. And primary care is extremely important, for us in the county. And again, because of the prevalence of disease. But how nice to have something so nice, so well fitted, especially for the needs of our community, with access to everybody and access to the specialty care that they basically need. And they're getting not just primary care, but they're getting academic medicine as well, which I think is very important for our patient population because it makes a big difference. And we do cover all the services, everything from rehab, all the lab services that the patients are going to need, and so on and so forth. All these designated health services we offer at RWJ Barnabas Health. Very exciting.
No, you and I have talked offline several times about just how passionate we are about health equity and bringing the same world-class care to every single neighborhood. So to have that here, and what I heard from her was not just primary care, specialty care, but patient-centric care.
Correct.
Everything
Absolutely.
From the fact that you can read your own chart in the EMR, electronic medical record. That's a game changer. They didn't have that when I was training.
Absolutely. In fact, that's one of the things that I use in my practice because, again, in my practice, I have a busy internal medicine practice. And again, it's old school, patients still call the number, the phone, but there's only so many lines we can have, and that's typically, I've been practicing in Hudson County for over 26 years. And the complaint universally always is, getting through the office and so on and so forth. But with our medical record, with our chart, the patients basically with my chart can actually set their appointments, they can set questions, if they need medication refills. So they have 24-hour access actually to our offices. And all of our RWJ Barnabas Health physicians, we have Epic, which is our medical records, and we have it on our phones, and we have it at home, and we have it at the office. So we have 24-hour, even when we're away. I was recently away, and it's impossible to get away. But I feel safer as a RWJ Barnabas Health physician, knowing that my patients, even if I'm on vacation, they have access to me. Their care is not ignored.
one of the most intriguing things about what we do is that health is so foundational to everything we do, right? That without your health, you really don't have anything. And Dr. Trespalacios really emphasized prevention, right? So not waiting to see the doctor when you feel like you're ill, but making it a part of health maintenance. So there's that part, but also that the system has so much access. You don't have to travel or go miles and miles or cross a tunnel. You can stay close to home and make sure you're getting regular preventative care through the entire spectrum of your life. I thought that was great. She talked about that.
And again, in Hudson County, this is kind of like a medical family. You know, we all know each other. We all trained. I for example, I trained at Jersey City Medical Center, so I'm home. You know, this is where I train. This is my community, and this is why I love shows like this that basically bring to Hudson County what are their medical needs. We want to hear about it, but we also want to tell you about us and about the great academic medicine that is actually being practiced here.
And the passion, the absolute passion we have for bringing world-class care to this community and being healthy together.
Yeah.
Right, changing the narrative about being healthy.
Yep.
That's great.
And again, we're doing across the board for everyone. All the services are provided for them. You know, they have access to us online at our website, et cetera, et cetera. So we were hoping that they actually join us, you know.
But we don't do it alone. It's not just the physicians or the nurses or the hospital infrastructure. There's the labs and the imaging and all those things that you have to get a prescription and travel to get. To have those in hubs under the same roof and getting that kind of comprehensive care, I think that's, you know, people know that they can do that close to home.
And again, that integrated primary care is really where the money is for a lot of patients, because a lot of patients have a lot of questions. You know, they have a lot of questions, and unfortunately, in our community, you know, the docs are busy and so on and so forth. I think at RWJ Barnabas Health, it's a little bit different. You know, we're more an academic practice. We understand the community that we serve, you know, and we would love to continue to hear what the community needs.
So Adam, we didn't plan this, but we're going to do this for our guests. 5 tips to choosing a good primary care doctor. You go
Excellent.
first.
Tip number 1, accessibility. Number 2.
Tip number 2, patient-centered.
Number 3, autonomy.
Number 4, accessible records.
Number 5, you're catching me.
I'll help you out. Hours.
Yes.
Weekend hours,
access.
some weekend hours.
Absolutely. But thank you. So we thank you once again for joining us, and we're hoping that you join us again next time. Thank you.
Thank you very much.
Thank you, Dr.